Hi, good morning. I'm you students. I'm Najwa from your Career Development Unit. I am very happy to have VidaJoie Singapore in the house today. We'll be talking about not just on what Sophia like is in Singapore, but also on the career path. Should you would like to work in somewhere apart from Malaysia. So welcome. We have Josephine and also Dr. Tan, Dr. David Tan from VidaJoie Singapore. So Josephine, can you tell a little bit about yourself and the establishment of VidaJoie in Singapore?
Hello Najwa and everybody at IMU. Welcome to Singapore. Welcome to VidaJoie Chiropractic Center. I'm the operations director. And I also perform physical therapy and work with our patients on behalf and wellness. First of all, let me introduce the company. Again, we've been established since 2015 and have helped more than 2,000 patients get better health. And through that, we empower them with joy. This is what our company is about. The word VidaJoie comes from a Spanish word vida, that means life, and joie is a French word for joy. So together, VidaJoie means a life of joy. If you improve your health, thereby you're empowered with a life full of joy. So that's what our motto is about. Yeah. So, and regarding this clinic, we're located in a square, in a very vibrant commercial hub. This area is called Paya Lebar. It's outside the fringe of Singapore. So if you have not visited, go ahead and Google us on the map and you will find us. Okay, shall I now pass the time over to Dr. Tan so that he can introduce more about himself and his special technique for chiropractic.
Hi, good morning everybody. My name is David Tan. I'm a graduate from the Sherman College of Chiropractic in the USA. I've been in practice for the last 5 years. Last 5 years, I look very old for that, right? But actually, I'm a mid-career transition. I only went to study chiropractic when I was 40 years old. Okay, so we are a high volume practice clinic. I see about 100 to 150 patients a week, depending on how many slots I can open up. And we are looking forward to helping a lot more people by expanding more slots. And therefore, I'm welcoming you to come join me. And why do you want to join me? Let me share how I actually do introduction to my patients on what chiropractic is all about, and you will find that the difference is that I emphasize a lot on the science, art, as well as the philosophy behind chiropractic. With this, then you are equipped with the necessary skill, passion, and mindset to go about to help your patients achieve the health that they desire. What do I mean? Okay, you can use this as a model answer. Eventually, even if you were to talk to your patients, I'll be more than happy to share this. All right, so imagine now that you're a patient. You come to me, I'll tell you that why do people come and see a chiropractor? They see a chiropractor usually because of 4 sensations that they feel along their spine that goes to their neck, their hands, and their limbs. It's pain, stiffness, numbness, or soreness. You will understand that usually it's because of pain, because patients will think that stiff, numb, sore are like whatever. When pain comes, something is wrong, we need to see a doctor, right? So first thing that they must know is that the 4 sensations are actually signals that's sent out by the body to try to tell them that something is wrong. They are not the problem itself. So pain, stiffness, numbness, and soreness are actually same signals that we should pay attention to. So where can the sensation be found? It can be found at the neck area. Stiff neck equals to stiff shoulder. Once you have a stiff neck and stiff shoulder, you will find yourself starting to have a rounded shoulder and a hunching posture. When that happens, shoulder joint will ache, elbow will hurt, wrist will hurt, fingers will get numb. All right? And beyond that, mid-back. When you have a mid-back strain due to the constant lunging forward of your head, the muscles here will be unable to hold you up straight. So you find your posture moving forward. Not only does that give you pain and stiffness, it also impedes your ability to breathe when your rib cage are closed in and your lungs are compressed. When you can't breathe well, you can't perform well up here. All right? Next, low back. This is the part that we injure all the time from first sports ever. Any injuries to the low back eventually will impact your hip. When you start to have an imbalanced hip, that's where your lower limbs are affected and your knee, ankle, and hip issues arises from there. So these are the musculoskeletal issues that people see a chiropractor for. We must always understand what is actually causing all these discomforts in order for you to effectively treat them. So two main reasons causes pain, for example. First is muscle spasm. Your muscles are attached to your spine. In order for your spine or for the matter, any skeleton to move, one side of the muscle must contract, one side must stretch. Doesn't matter which direction. So for whatever reason, injury, bad posture, or simply pitch too high, pitch too low, and your spine gets stuck in this position, and you realize that all the muscles here will perpetually be contracted. Here will always be stretched. When this happens, this is why no matter how you massage, acupuncture, tuina, or even do physiotherapy, effects are minimal because all those modalities focus on the muscles. But the muscle has to follow who? The spine. So correct the spine, muscles will relax. A lot of good stuff will come about from the manual therapy elsewhere. Next, which is basically the most important thing about chiropractic, is the second reason that pain or discomfort are experienced. Spine is out of alignment, muscles are tight. These two in combination will start to compress your nerves. So when your nerves are compressed, they're inflamed. Inflamed, you get the deep down pain, stiffness, numbness, and soreness. Remember, we said that all these were just signals of help by the body. So what's really happening when your nerves are compressed? Nerve compressed would mean that your brain is unable to use the compressed nerve to talk to this part of the body which the nerves are connected to, thereby unable to control how the body functions properly. Secondly, the body cannot use the same nerves to feed back to the brain whether it is okay, not okay, I need more of this, I need less of that, help me or don't bother about me. So when there's this internal miscommunication occurring within the body, your self-regulation go out of sync. Without self-regulation, you'll find your health going downhill. You break down more often, you degenerate faster, and patients usually only listen to the third one. You age a lot faster. All right, so chiropractic is not just about identifying where the pain is, where your complaints are, and then applying the right thrust, the right correction to alleviate the pain or relieve the pain symptom. It is to make sure that we go to the source of the problem, which is nervous impingement due to nerve compression. We sort out the spine so that the muscles can relax, so that the nerves no longer get impinged, and therefore the body starts to self-communicate properly, self-regulate properly, and self-healing will then take place. This is the most important thing that I find that chiropractic does. We are not just another bone setter, we are not just another physiotherapist, we are actually spine specialists taking care of the nervous system in order for the body to work well by itself. I just give you one simple example to illustrate this point. Diabetes. In the course of your career to come, you will find out that a lot of patients will have diabetes even though they are not middle-aged, even though they are not obese, even though they don't eat sweet stuff all the time. Difference is that they do not need to inject insulin, but they just need to take insulin stimulants. How come? A patient that comes to me that has a back problem, back pain problem, and happen to have a high sugar or are diabetic, I will know that the diabetes is caused actually by the nerves that goes to your pancreas being blocked. Brain tries to activate insulin production. Nerve block, pancreas did not hear, pancreas don't work. Therefore, you only need insulin stimulant to get the pancreas to produce insulin. The fact that the pancreas can produce insulin even without injection means that the pancreas is not spoiled. It's just that the message is not getting through to it. So therein lies the science, art, and philosophy of chiropractic. All right, we are here to make people's life become healthier and not just giving pain relief. Okay. Next, most important thing about then how do we go about to achieve it? I know in school we have been taught to, oh, there's a misalignment here, let's adjust here. There's a misalignment there, let's adjust there. There's a misalignment here, let's fix it. Okay, so don't be surprised if there are practices out there that requires the patient to come back 3 times a week for 6 months, so that every time this is saying it, we will correct. But one fundamental question that is not asked is there a source or a primary cause of the spine being misaligned? Traditional chiropractic tries to fix everything, but if the body is so amazing as what I've just said, wouldn't we be able to find a point, correct it, if that's the primary, and then the rest of the body will realign? Okay, this is where my technique comes in. I practice torque release technique mainly, and this technique is about using an instrument called the integrator. Integrator is not your activator. It actually comes with a torque element. That means I can as I adjust the spine. So I don't have to do this all the time. Instrument does it for me. All right. And towards the end of the presentation, I'll demonstrate to you exactly what I mean by how I can use a simple instrument that doesn't require me to use a lot of effort to try to correct the source of the misalignment or subluxation within the patient's body. Okay? Let's wait for my demonstrator to come along and I'll show you my technique. All right, let's have the patient come up to the table.
Mm-hmm.
Go to your right, please. Left, please. Okay, center. Okay. Thank you. There is a typical adjustment that I do. Looks very light on the body, simple to implement, and how do I actually go about doing it? Don't worry, if you come work for me, I'll teach you this technique to let you be able to easily adjust your patient to achieve the 70 to 80% efficacy rate that the clinic is experiencing. That's why you realize we do not put up advertisement, sell packages. All we get is referral from existing patients to let us grow from 0 5 years ago to about 2,500 patients database that I'm seeing today. All right.
What is the name of the technique again, Dr. Tan? The name of the technique? What is the name of the technique again?
Technique is called TRT, torque release technique. All right. I use this as mainly my adjustment technique, and I add on other skills that I learned to make it a complete protocol that is replicable by any doctor that I train, so that we can achieve the same outcome for most of our patients. Okay, so right now I will hand it over to Jo for her to talk about her department.
All right. So I just realized that I've been pronouncing the company's name all this time wrongly. It is actually VidaJoie, is it?
Zua.
Zoa.
Yes,
VidaJoie.
ZWA.
Yeah. So thank you so much, Dr. Tan. That is a very detailed explanation on the techniques and philosophy that been used in VidaJoie.
Wow.
So now we'll move to Miss Josephine, who will going to explain us a little bit more on the career path as a chiropractor.
Okay, so now that we have heard from the man who's the backbone of the company, pun intended, okay, now welcome to my department, which is rehab and wellness. I work closely with Dr. Tan. Once he has helped the patient with structural alignment, there will be some soft tissue work that we need to work on, especially for patients who have scar tissue because of the injury in the muscles, the tendons and ligament. This is where I come in. I use a variety of instruments like shockwave therapy, okay, the muscle stimulation and cold laser. All this depending on the patient's condition and necessity. Okay, the aim is to provide the person with an enhanced efficacy of healing. Okay, so that they can heal total in a complete manner. So we take care of the patient from literally from top to toe, inside out. I will also teach the patients about some rehab exercises that they can do, okay, to help themselves in their healing and also to prevent future injury. On top of that, we will also discuss a little bit about nutrition and how they can improve their lifestyle as a whole. That's why not forgetting the motto of our company is to empower your life with joy through regaining your health. Okay, so that's how we work together. If you have what it takes and you share the same conviction as us, you're very welcome to come join us as a chiropractor or as a physical therapy. Okay, so you will, once you're on board, we will provide you with all the necessary training so that you can, like Dr. Tan said, you can practice with the same consistent manner and achieve the same efficacy. Okay, so we aim to have very happy patients. We always see our patients very happy when they leave our clinic. They're always very excited to come. Okay, and how about the process? Okay, of course, you start by writing into us with your CV, your results, and a little story about yourself, your chiropractic story. Why do you want to become a chiropractor, and how would you? What is your aim in terms of working with patients? Your aim and objective, and what's your vision? Okay, if you are shortlisted, we will conduct an interview by Zoom so that we can understand a little bit more about you. Okay, and upon successful selection, you'll be invited for a visit to Singapore, where you can hang out with us for a day, see how we operate, and familiarize yourself with the environment, the surrounding, and maybe recce a bit, about the location, your accommodation. And then we can start the process of application for a work permit and employment pass in Singapore. We will work along with you very closely in terms of the whole process plus accommodation to be well taken care of. Okay, so we will train you to work with us and eventually perhaps run your own clinic. Okay, thank you, Najwa.
Thank you so much. I think that's a very clear explanation on how to apply as a chiropractor at VidaJoie if you are interested. But most importantly, we get to know how is the chiro clinic in other country apart than Malaysia do their operation. Any last word for our student, Josephine?
Okay, I think it's very clear that you should do everything with passion, with your heart. Okay, think less about how much you're going to earn, how big a business you're going to develop. More about helping patients to regain their health, have a better life. The rewards will come to you. You're going to gain many patients, and you're going to see your practice expand. Okay, so this is what Dr. Tan always says. Just do it with your heart. Okay, and you practice more, you will gain more experience, and you will gain more patience. Anything else, Dr. Tan?
Any last word for our IMU student, Dr. Tan?
If you have the heart, I will provide you with the skills. Josephine will provide you with the business mentality so that eventually when you are done with us, you're all set to go back to where you are or continue working in Singapore as the best chiropractor that you can become. I look forward to hearing from you and seeing you guys. Thank you.
Thank you. Thank you so much to both
To get
Dr.
more
Tan.
information about our company, you can always visit our website or Facebook page. Very simple, just type in VidaJoie, VidaJoie, VidaJoie Chiropractic. You will be able to find us and drop us an email or a message. Okay?
Okay, so if you have any question with regards to the company, you can always drop them an email. I believe they will be more than happy to reply to you. I think that's all for today. Thank you so much again, Dr. Tan and also Josephine. I hope to be working again with you guys closely next year after the MCO lifted, so you maybe can come again to our campus.
We will. We look forward to that. Thank you, Najwa.
Thank you. Bye.
Bye.